I still think about a Thursday afternoon appointment with a woman named Bettina Marsh because it taught me something I now share with almost every patient who sits across from me in this office. Bettina was 67 years old, a retired church choir director from Charlottesville, the kind of woman who filled a room with energy the moment she walked into it. She came to see me for what she described as a strange, brief episode a few days earlier. She'd been reaching for a coffee mug in her kitchen cabinet, and for about 90 seconds, her right hand simply wouldn't cooperate. She dropped the mug. Her fingers felt clumsy, almost like they belonged to someone else. Then, just as quickly as it started, it passed, and she went about her day, chalking it up to her hand, falling asleep in a strange position. She almost didn't mention it to me at all. It was only because her daughter had noticed her slurring a single word at dinner that same evening, just one word, gone as quickly as it appeared, that she brought it up. What Bettina experienced that afternoon in her kitchen was not her hand falling asleep. It was a transient, ischemic attack, often called a mini-stroke, and it was her brain sending her a warning message, one that, thankfully, she brought to me before it repeated itself as something far more serious. If you're watching this video, I want you to understand something clearly, right from the start. Strokes rarely arrive without warning. The dramatic, sudden collapse you see portrayed in movies is real, but it's often the final chapter of a story your brain has already been trying to tell you, sometimes for weeks or even months beforehand, through signs so subtle, so easy to explain away, that most people, and honestly, many doctors in a rushed appointment, miss them entirely. Today I want to walk you through 5 of these signs, the quiet ones, the ones that don't announce themselves the way you might expect, and I want you to really listen closely to the third one, because in my nearly 20 years of practice, it's the one I've seen dismissed more often than any other, usually with tragic consequences. My name is Dr. Anderson Coco. I've spent close to 2 decades focused almost entirely on the health of people over 60, first within a large hospital system here in Virginia, and for the past 10 years through my own private practice, built around a single mission, helping older adults protect their independence, their clarity of mind, and their long-term health before problems become emergencies. This work is deeply personal to me. My own grandfather suffered a major stroke in his late 70s, one that, looking back with everything I now know as a physician, had been preceded by warning signs that nobody in our family recognized at the time. That experience shaped the entire direction of my career, and it's a large part of why I spend so much of my time today teaching people exactly what I'm about to share with you. Before we get into the 5 signs themselves, I want to give you some background on why strokes tend to sneak up the way they do, because understanding the mechanism actually helps you recognize the warning signs far more easily when they show up in your own life or in the life of someone you love. A stroke happens when blood flow to part of your brain is interrupted, either because a blood vessel becomes blocked, which doctors call an ischemic stroke, and which accounts for the vast majority of cases, or because a blood vessel actually ruptures, which is called a hemorrhagic stroke. In both cases, brain cells in the affected area are starved of oxygen and begin to die within minutes, which is exactly why speed matters so much once a major stroke is underway. What most people don't realize is that the blood vessels in your brain often give off small, temporary warning signals well before a major blockage or rupture occurs, essentially brief moments where blood flow is disrupted just enough to cause a symptom, but not long enough to cause lasting, obvious damage on its own. These are the transient ischemic attacks I mentioned with Bettina, and research consistently shows that roughly 1 in 3 people who experience one will go on to have a full stroke within a year if the warning is missed or ignored, with a significant number of those strokes occurring within the very first few days or weeks after the initial warning sign. That statistic alone is exactly why I wanted to sit down and make this video for you today. I also want to mention, before we move into the signs themselves, that strokes have historically been misunderstood as something that simply happens without cause, almost like bad luck striking at random. Medical understanding of stroke has changed dramatically over the past 50 years. In the 1970s and 1980s, most of the public conversation around stroke centered entirely on the aftermath, rehabilitation, recovery, learning to live with lasting effects. It's only in the last 2 or 3 decades, as imaging technology improved and researchers were able to study blood vessels in far greater detail, that we began to understand just how often the brain sends measurable, detectable warning signals well in advance. This shift in understanding is genuinely one of the most important developments in preventive medicine for older adults, because it means that a stroke, in many cases, is not a sudden, unpredictable event at all. It's often the predictable final step in a process that began weeks or months earlier, one that could have been caught and addressed if the earlier signs had been recognized for what they truly were. Let's talk about the first silent sign, and this one connects directly to blood sugar in a way that surprises a lot of my patients when I first explain it. Sudden, brief episodes of confusion or difficulty finding the right words, what doctors sometimes call word-finding difficulty, can be an early warning sign of reduced blood flow to the language centers of the brain. But here's the layer most people miss entirely. Blood sugar instability, particularly in people with undiagnosed or poorly managed prediabetes and type 2 diabetes, both of which are extremely common in adults over 60, damages the small blood vessels throughout the brain over time, making them significantly more prone to these brief disruptions in blood flow. I've had patients describe searching for a common word, something as simple as the name of a grandchild or a household object, and having it simply vanish from their mind for a few seconds before returning as though nothing had happened. When this happens repeatedly, especially alongside any history of blood sugar concerns or a family history of diabetes, it deserves real attention and a real conversation with your doctor, not dismissal as a normal, expected part of getting older. I want to add here that this particular sign is often the one my patients feel most embarrassed about, because in a culture that already jokes about forgetfulness and aging, a moment of word-finding difficulty gets brushed off with a laugh far too easily. I'd encourage you to resist that instinct in yourself and in the people you love, because the brief, recurring version of this symptom is a very different thing from ordinary, occasional forgetfulness. The second silent sign involves vision, specifically brief episodes of blurred vision, double vision, or a curtain-like shadow passing over one eye, sometimes described by patients as though a window shade is being pulled down and then released. This happens because the blood vessels serving your eyes are directly connected to the same circulatory network that serves your brain, sharing many of the same small arteries, and a temporary disruption in that shared blood flow can affect vision before it affects anything else noticeable. This is where blood pressure becomes directly and measurably relevant. Chronically elevated blood pressure damages the delicate blood vessels behind the eyes and throughout the brain simultaneously, making these brief visual disturbances considerably more likely to occur over time. Many of my patients describe these episodes as lasting only a few seconds to a couple of minutes, and because they resolve so quickly and completely, they're almost always dismissed as eye strain, a need for new glasses, or simple fatigue from a long day. I want you to know that any sudden, unexplained visual disturbance, even a brief one, especially if it happens more than once within a short period, deserves a real conversation with your doctor, not a shrug and a decision to simply keep an eye on it yourself. I'll add one more detail here that I think is worth knowing. Eye doctors are often the first medical professionals to catch early signs of vascular damage in the body, simply because the blood vessels at the back of the eye are the only ones in your entire body that can be viewed directly without any imaging equipment at all. If it's been more than a year since your last comprehensive eye exam, that appointment alone can sometimes reveal early warning signs of exactly the kind of vascular damage we're discussing today. The third sign, the one I promise to spend real time on, is subtle facial changes that come and go, particularly a slight drooping or heaviness on one side of the face that appears for a short time and then seems to resolve completely, often within minutes. I want to tell you about a patient named Roland Ashby, 71 years old, a retired postal supervisor from Petersburg, because his story illustrates exactly why this sign gets missed so often, even by families who are paying close attention. Roland's wife noticed one evening that the left side of his smile looked slightly off during dinner, just barely uneven, the kind of thing you'd only catch if you were looking closely and knew his face well after decades of marriage. Roland felt completely fine, no pain, no confusion, nothing that felt alarming to him at all in the moment. By the next morning, his smile looked completely normal again, and he genuinely believed nothing significant had happened the night before. It was only because his wife insisted, gently but firmly, that they come see me, that we caught it in time to make a real difference. When I examined Roland and reviewed his blood pressure history, along with some additional testing I ordered that same week, it became clear that he had experienced a genuine transient ischemic attack, and his risk factors, including blood pressure that had been quietly creeping upward for over a year without him fully realizing it, put him squarely at high risk for a major stroke in the near future. We were able to intervene, adjust his treatment plan meaningfully, and significantly reduce that risk, specifically because his wife didn't let that brief resolving symptom get waved away as nothing worth mentioning. This is precisely why this particular sign matters so much to me personally. Because it resolves on its own, because there's often no pain attached to it whatsoever, and because the person experiencing it frequently feels completely normal again within minutes, it gets dismissed more consistently than almost any other stroke warning sign I encounter in my entire practice. If you ever notice even a brief, subtle change in your own face or in the face of someone you love, please do not wait to see if it happens again before acting. Treat it as the urgent signal it actually is. Every single time. There's a simple test I teach every one of my patients and their families, and I want to share it with you right now because it takes only a few seconds to perform. Ask the person to smile widely, raise both arms above their head, and repeat a simple sentence back to you clearly. If one side of the smile droops, if one arm drifts downward without the person noticing, or if the sentence comes out slurred or garbled in any way, treat that as an emergency and call for help immediately, even if the symptoms seem to be already fading as you watch. The fourth silent sign is sudden, brief dizziness, or a feeling of unsteadiness, particularly when it occurs without any clear trigger, like standing up too quickly or spinning around on purpose. This connects directly to heart health, and here's why that connection matters so much. Your brain requires an incredibly steady, consistent supply of oxygenated blood at all times, and irregular heart rhythms, particularly a condition called atrial fibrillation, which becomes significantly more common after age 60, can cause tiny, temporary drops in blood flow to the brain that manifest as brief dizziness or a sense of the room gently tilting beneath you. Atrial fibrillation is also one of the single biggest risk factors for stroke in older adults specifically because it allows small blood clots to form quietly inside the chambers of the heart, which can then travel directly to the brain and cause a blockage. I've had patients describe these dizzy spells as lasting only a few seconds, sometimes barely noticeable enough to mention to anyone, and because they don't fall or lose consciousness during these episodes, they assume it's nothing more than standing up a bit too fast or simple everyday fatigue. If you experience recurring, unexplained dizziness, especially if you've never had a proper heart rhythm evaluation done, this is genuinely worth bringing to your doctor's attention directly and specifically at your very next visit. Many primary care offices now offer simple, painless heart rhythm monitoring that can be worn for a day or two at home. And for many of my patients, that small, easy step has been the single most important test they've had done in years, simply because it catches an irregular rhythm that a brief, one-time office visit would almost certainly miss entirely. The fifth and final silent sign is a sudden, temporary weakness or heaviness in one arm or leg, even if it fully resolves within minutes, which is exactly what happened to Bettina in her kitchen at the very beginning of this video. This sign often gets attributed to a limb simply falling asleep, especially if it happens after sitting or lying in one position for an extended period. But there's a meaningful, important difference between a limb falling asleep, which typically comes with a pins and needles tingling sensation and resolves gradually as you move and shake it out, versus a sudden, sharp weakness that affects your grip strength or your ability to walk normally, even briefly, which tends to resolve more abruptly on its own without that same tingling warning. This particular sign also ties back to inflammation in a way that's genuinely worth understanding fully. Chronic, low-grade inflammation throughout the body, often connected to diet, blood sugar instability, and unmanaged joint conditions, contributes directly to the kind of blood vessel damage that makes these brief episodes of weakness considerably more likely to occur over time. Managing inflammation throughout your body through proper hydration, an anti-inflammatory diet rich in vegetables and healthy fats, and appropriate regular movement genuinely supports the health of the blood vessels throughout your entire brain, not just the ones serving your joints. I want to share 2 more patient stories with you now because I think together they tie all 5 of these signs into a single, complete picture in a way that really drives the point home. There was a woman named Corinne Blackwood, 65 years old, a retired dental hygienist from Lynchburg, sharp, active, and genuinely health conscious by every measure I could see on paper when she first walked into my office. Over the course of about 6 weeks, Corinne experienced, in order, a brief moment of word-finding difficulty while talking with a close friend over coffee, a few seconds of blurred vision in her left eye while driving home from the grocery store, and then, about 10 days later, a fleeting moment of unsteadiness while walking through her own kitchen. Each individual episode lasted less than a minute. Each one resolved completely on its own, without any lasting effect she could notice. And because each one seemed so minor and so disconnected from the others in her mind, Corinne genuinely didn't think to mention any of them during her annual checkup with her primary doctor until a routine conversation with me, prompted by an entirely unrelated visit for something else altogether, uncovered the full pattern when I simply asked the right series of questions. Once we connected all 3 episodes together and ran the appropriate testing, including imaging and a full cardiac workup, it became clear that Corinne had experienced a series of transient ischemic attacks over that 6-week period, and her risk of a major stroke in the coming months was genuinely significant. We intervened immediately, adjusting her blood pressure management and starting her on an appropriate treatment plan tailored specifically to her situation. And to this day, Corinne has not experienced a major stroke. I share her story because it illustrates something absolutely crucial for you to understand. These signs rarely show up as one single dramatic event. They often arrive quietly, spread out over days or weeks, each one easy to dismiss individually and in isolation, and it's only when you know to look for the pattern connecting them that the full, complete picture becomes clear. The second story I want to share is about a man named Herbert Doyle, 69 years old, a retired accountant from Danville, who came to see me after his son mentioned, almost as an afterthought during a routine phone call, that his father had seemed to slur a word or two while talking about the weather one afternoon, only for it to pass within seconds. Herbert himself hadn't even noticed it happening at all. When we examined him closely and reviewed his full history together, we discovered he'd also been experiencing occasional brief moments of leg weakness while gardening, something he'd attributed entirely to simple muscle fatigue from working outdoors in the heat. Neither symptom on its own had seemed worth mentioning to anyone, including his own doctor at his last checkup. Together, they told a very different and far more urgent story, one that led us to catch and address his stroke risk well before it became a genuine emergency requiring hospitalization. What struck me most about Herbert's case was how ordinary both symptoms seemed in isolation, easily explained away by 2 completely unrelated everyday causes, weather and gardening, when in reality, his brain had been sending the same underlying signal twice within the same month. Before I move into the mistake I see most often, I want to spend a little more time on why these 5 signs, taken together, matter so much more than any single one of them considered alone. In medicine, we often talk about something called a symptom cluster, which simply means a group of individually minor signals that, when they appear close together in time, point towards something far more significant than any one of them would suggest on its own. Think of it this way. A single afternoon of feeling a bit tired doesn't mean much, but a single afternoon of feeling tired, combined with a brief moment of blurred vision the same week, combined with a few seconds of unsteadiness on the stairs a few days later, tells an entirely different story once you step back and look at the full picture. This is exactly what happened with Corinne, and it's exactly what happened with Herbert. Individually, their symptoms were forgettable. Together, they were unmistakable. I want you to start thinking about your own health and the health of the people you love with this same wider lens, rather than evaluating each small moment in complete isolation from everything else happening around it. I also want to walk you through a few of the deeper risk factors that make someone more likely to experience these silent signs in the first place, because prevention is always more powerful than catching a warning sign after the fact. High blood pressure remains, by a wide margin, the single largest controllable risk factor for stroke in adults over 60. Even blood pressure readings that fall into what doctors call the borderline or elevated range, numbers that don't quite reach the threshold for a formal diagnosis of hypertension, have been shown in long-term research to meaningfully increase the risk of these small vascular events over time. This is part of why I encourage every patient in your age group to know their own blood pressure numbers, the way you know your own phone number, checked regularly, tracked over time, and discussed openly with your doctor, rather than checked once a year and forgotten about until the next appointment. Cholesterol plays a meaningful role here as well, particularly a specific type called LDL cholesterol, which contributes over years to the slow buildup of plaque inside the arteries that supply blood to the brain. This buildup process, called atherosclerosis, narrows these vital blood vessels gradually, and it's often this narrowing that sets the stage for the kind of brief blockages responsible for the transient warning signs we've discussed today. The encouraging news here is that cholesterol, like blood pressure, responds meaningfully to lifestyle changes, particularly diet, regular movement, and in some cases, appropriate medication guided by your own physician based on your individual risk profile and family history. Sleep quality is another factor that rarely comes up in this conversation, yet it genuinely deserves more attention than it usually receives. Poor sleep, particularly undiagnosed sleep apnea, which becomes considerably more common as we age and is often present without the loud snoring most people associate with it, causes repeated brief drops in blood oxygen levels throughout the night. Over months and years, these repeated overnight dips place ongoing stress on the same blood vessels we've been discussing throughout this entire video. If you or your spouse has ever noticed pauses in your breathing during sleep, or if you wake up feeling unrested despite a full night in bed, that's genuinely worth raising with your doctor, because treating sleep apnea effectively has been shown to meaningfully reduce stroke risk over time in patients who have it. This brings me to the mistake I see most often surrounding stroke risk in my practice, and it's simply this. People wait for pain. They wait for something dramatic, something undeniable and unmistakable, before they take a symptom seriously enough to pick up the phone and call their doctor. But as I hope today's video has made abundantly clear, some of the most important warning signs your brain will ever send you arrive without any pain at all, resolve completely within minutes, and leave you feeling entirely normal shortly afterward. The mistake isn't a lack of awareness that strokes are serious. Everybody already knows that much. The mistake is not recognizing that these brief, painless, quickly resolving episodes are often the earliest and most treatable warning your body will ever give you, and that the window to act on that warning is often much shorter than people assume. I want to take a moment here to talk specifically about diet, because it's one of the most common questions I get asked once patients understand the connection between blood vessel health and stroke risk. You don't need a complicated meal plan to meaningfully protect your brain's blood supply. Research consistently points to a small number of genuinely powerful habits. Leafy green vegetables, things like spinach and kale, are rich in nitrates that help blood vessels relax and function more efficiently. Fatty fish, like salmon and sardines, provide omega-3 fatty acids that have been shown to reduce inflammation throughout the vascular system. Berries, particularly blueberries, contain compounds that support the flexibility of blood vessel walls over time. And reducing sodium intake, particularly from processed and packaged foods rather than salt added at the table, remains one of the single most effective dietary changes for blood pressure control in adults over 60. None of this requires perfection. I tell my patients that consistency over years matters far more than any single perfect meal, and even modest, sustainable changes made steadily over time produce meaningful protection for your brain's blood supply. I want to share one more story with you because I think it illustrates something important about how these 5 signs can sometimes hide behind an otherwise completely healthy lifestyle. There was a woman named Priscilla Vance, 62 years old, a retired physical therapist from Winchester, someone who had spent her entire career telling other people how to take care of their bodies. Priscilla walked 5 miles most mornings, ate carefully, and had never smoked a cigarette in her life. When she came to see me, it wasn't for anything urgent. She simply mentioned, almost as a passing comment near the end of a routine visit, that she'd had 2 brief episodes over the previous month where her left hand had felt oddly heavy while gardening, each lasting less than a minute before resolving completely. Because she was otherwise the picture of health, she'd assumed it couldn't possibly be anything serious. Her family history told a different story. Her father and an older brother had both experienced strokes in their 60s. When we ran a full evaluation, we discovered Priscilla had a heart rhythm irregularity she never knew about, one that had gone completely undetected because she'd never had a reason to be screened for it. We addressed it immediately, and Priscilla continues her morning walks today, now with a treatment plan that significantly reduces her risk. Her case is a reminder that these silent signs don't discriminate based on how healthy someone otherwise appears to be, and that family history deserves real weight in how seriously you take even a seemingly minor symptom. I also want to spend a moment on something connected to all of this that doesn't get discussed nearly often enough, which is the emotional and psychological side of recognizing these warning signs. Many of my patients tell me, after the fact, that some part of them sensed something was wrong during one of these brief episodes, but they talked themselves out of acting on that instinct because they didn't want to seem dramatic or because they didn't want to burden a family member with a concern that might turn out to be nothing. I understand that instinct completely, and I want to gently push back against it. Erring on the side of caution with a brief neurological symptom costs you, at most, a phone call and perhaps an unnecessary appointment. Ignoring one, on the other hand, can cost you far more than that. I would rather see you in my office 10 times for something that turns out to be nothing than have you stay home once for something that turns out to matter. I think it's worth spending a moment on why acting quickly matters so much, beyond simply preventing a stroke from happening in the first place. If a major stroke does occur, the speed of treatment afterward has an enormous impact on long-term outcomes. There's a treatment window, generally within the first few hours after symptoms begin, during which certain clot-dissolving medications and procedures can dramatically limit the amount of lasting damage to the brain. Every minute that passes during a stroke, brain cells are being lost, which is why the medical community uses the phrase "time is brain" to describe just how urgent this window really is. This is precisely why recognizing the 5 silent signs we've discussed today matters so much, not only because they can warn you before a major stroke occurs, but because if a major stroke does happen despite everything, knowing to act immediately rather than waiting to see if symptoms pass can be the difference between a full recovery and a lasting disability. I've seen this play out in both directions throughout my career. Patients who arrived at the hospital within that critical window and walked out days later with no lasting effects at all, and patients who waited, hoping symptoms would resolve on their own, and ended up with permanent limitations that could very likely have been avoided. I also want to address something I hear often from patients and family members alike, which is a reluctance to call for emergency help over something that might turn out to be nothing. I understand this instinct, and I want to address it directly. Emergency medical services would always, without exception, rather respond to a call that turns out to be a false alarm than miss the opportunity to treat a genuine stroke within that critical early window. There is no such thing as wasting anyone's time by calling about a sudden neurological symptom, even one that has already started to fade by the time help arrives. I would encourage you to release yourself completely from any worry about being seen as overly cautious. In this particular area of health, caution costs you very little, while hesitation can cost you everything that matters most. So what should you actually do if you experience any of these 5 signs, even briefly, and even if it seems to resolve completely on its own? First, and this matters more than anything else I'll say to you today, treat any sudden neurological symptom, no matter how brief or seemingly mild, as something worth calling your doctor about the very same day, rather than waiting to see if it happens again before acting. Second, if you know your family history includes stroke, high blood pressure, or heart rhythm issues, ask your doctor directly whether you should be screened for atrial fibrillation, particularly if you've experienced any unexplained dizziness recently. Third, keep a simple written log if you ever notice anything even remotely resembling these signs, including the date, the time, and exactly what you experienced in your own words, because as Corinne's case and Herbert's case both show clearly, the pattern across multiple episodes often matters far more than any single episode considered on its own. Fourth, focus consistently on the foundational habits that protect your blood vessels every single day: proper hydration throughout the day, consistent blood pressure, monitoring at home, blood sugar management through diet and activity, and regular gentle movement, because every single one of the 5 signs we discussed together today ties back to the underlying health of your blood vessels in some meaningful way. Fifth, and this one is often overlooked, make sure at least one person close to you, a spouse, an adult child, a close friend who sees you regularly, knows these 5 signs as well as you do, because in Roland's case and in Herbert's case alike, it was someone else who first noticed the symptom, not the patient himself. Sixth, if you live alone, consider talking with your doctor about a simple wearable device that monitors heart rhythm or detects falls, since many of my patients who live independently have found real peace of mind and genuine added safety in having a small piece of technology quietly watching for exactly the kind of irregularity we've discussed today, even when no one else is in the room with them. I want to close this section by saying something I tell nearly every patient who sits across from me after a conversation like this one. None of these 6 steps require you to become a different person or to reorganize your entire life around fear of what might happen. They simply require a small shift in attention, a willingness to notice the brief and unusual, and the confidence to act on that noticing rather than talking yourself out of it. That shift, small as it sounds, is genuinely one of the most protective things you can do for your own long-term health. I think it's also worth understanding just how much your risk profile shifts as you move through your 60s, 70s, and beyond, because this context helps explain why I focus so much of my practice on this particular age group. Stroke risk roughly doubles with each decade after age 55, which means the conversations we're having in this video today matter more with each passing year, not less. But I want to balance that fact with something genuinely encouraging. The vast majority of stroke risk factors we've discussed today, blood pressure, blood sugar, cholesterol, sleep quality, hydration, and inflammation, are all things you have real, meaningful influence over, regardless of your current age. I've had patients in their 70s make significant improvements to their blood pressure and overall vascular health within a matter of months, simply by adopting the kinds of small, sustainable changes we've talked about throughout this video. It is genuinely never too late to meaningfully reduce your own risk, and I never want anyone watching this to feel like their age alone has already decided their outcome for them. I want to be very clear about something before we move toward closing this video out, because it matters deeply to me and to how I practice medicine. I am not diagnosing anyone watching this video with stroke risk. And I am not telling you that any single brief symptom you may have experienced in the past definitely indicates that a stroke or mini-stroke occurred in your case. Only proper medical evaluation, imaging, and thorough testing by your own physician can determine that with any real confidence. What I want you to walk away with today is simply this: a genuine working awareness of these 5 patterns, so that if you or someone you love ever experiences something similar in the future, you know to take it seriously immediately, rather than waiting to see if it resolves or quietly repeats itself down the road. One last practical note before we wrap up. If you're watching this with a spouse or a family member nearby, I genuinely encourage you to pause the video right now and talk through what you just heard together while it's still fresh in both of your minds. So much of what makes these 5 signs dangerous is that they're easy to forget about once the moment is past and life moves on. Talking it through together right now, while the details are still clear, is one of the simplest things you can do to make sure this information actually protects you when it matters most, rather than fading into the background the way so much health information unfortunately does. If this video gave you something genuinely worth thinking about today, please take a moment to hit that subscribe button, because I share information exactly like this every single week. Real, practical, research-grounded guidance built specifically for people over 60, explained the way I genuinely wish someone had explained it to my own grandfather years before his stroke ever happened. And I would love to hear from you directly down in the comments below this video. Have you or someone in your family ever experienced a brief, unexplained symptom like the ones I described here today? I'd genuinely like to know, because sharing these stories openly helps other people in this community recognize the very same signs in their own lives before it's too late for them to act. Here is your challenge for this week, and I want you to genuinely follow through on it rather than simply nodding along. Sit down with someone you love, a spouse, a son or daughter, a close friend you trust, and simply talk through these 5 signs together, out loud, in your own words. Practice the simple face, arms, speech test I described earlier, so it feels familiar rather than unfamiliar if you ever actually need it. Make an agreement with each other that if either of you ever notices anything resembling word-finding trouble, brief vision changes, subtle facial drooping, sudden dizziness, or temporary limb weakness, you'll call each other immediately and treat it seriously, rather than waiting quietly to see if it passes on its own. I also want to leave you with one final thought before we close today. Nothing I've shared with you in this video is meant to make you anxious about every passing sensation in your body. Most brief moments of tiredness, most minor aches, most everyday dizziness from standing up too quickly are exactly what they appear to be: ordinary and harmless. The goal here isn't to have you living in a state of worry, scanning your body constantly for signs of danger. The goal is simply to help you recognize the specific pattern of these 5 particular signs: brief, sudden, resolving on their own, and often appearing without any pain, so that if they ever do show up in your life or in the life of someone you love, you know exactly what you're looking at and exactly what to do next. Knowledge like this isn't meant to create fear. It's meant to replace fear with clarity and confident action, which is a very different thing entirely. Next week, I want to talk about a morning habit that quietly affects millions of people over 60, one that feels completely harmless, even genuinely responsible, but that doctors rarely have the time to explain fully during a routine 10 or 15-minute appointment. You won't want to miss that conversation either. Until then, take care of yourself the way you'd take care of someone you love deeply, because recognizing these quiet signs early is one of the most powerful things you can ever do for your own future and for the people who love you most. I'll see you in the next video.